Sexual violence can have complex and far-reaching impact upon its victims' quality of life. Older women are particularly vulnerable to sexual violence. Abusers are most often men who are their caregivers, intimate partners, or family members. Sexual violence can be defined as non-consensual sexual-oriented behavior, including physical assault, exploitation, or emotional intimidation. It can be overt in nature and consist of behaviors like kissing, inappropriate touching, and anal or vaginal rape. It may also be covert, like sexual harassment, inappropriate comments, and threats. Improper use of enemas and inappropriate genital washing by caregivers may also be sexually violent behaviors. Both men and women are subject to traumatic encounters, but men have them more often than women. Women develop PTSD twice as often as men. This is due to the pervasiveness of sexual violence and psychological injury experienced by women. Sexual violence is enabled by an imbalance of power between the offender and victim. Vulnerability increases when older adults live with another person and have no one else to help them. In 2/3 of confirmed cases involving older adults, the aggressor was a family member. Cognitive impairment also raises risks. Women sexually abused as children are at higher risk for being sexually abused as adults. The aftermath of sexual violence can be most severe for older victims. Women over age 55 are more likely to suffer genital injury from sexual assault than those 18 to 45 years of age. In the worst cases of assault involving frail victims in nursing homes, death occurs within a year. Physical signs of sexual abuse include breast and/or genital bruising, unexplained STDs, and atypical genital bleeding. Individuals who are sexually abused are disposed to changes in how they experience and express their sexuality. Sexual identity is defined through the constructs of gender identity, sexual orientation, gender roles, and sex roles. Gender identity involves inward feelings and outward appearances. Sexual roles are individual roles in procreation. Sexual orientation involves sexual attraction. Gender roles stem from societal expectations about what is acceptable behavior based on being male or female. When an older woman is abused by her spouse, she may avoid getting a divorce due to belief that it would be a sign she has failed in her life's work to uphold her family's structure and her role as wife and mother. Fearing shame from failure and a belief she is at fault, she is driven to maintain outward appearances of a conjugal unit. Researchers recommend trauma-specific service approaches as a function of the continuum of care in community-based agencies and long-term care facilities. Trauma tends to target the most vulnerable members of society. It can cause neurobiological and psychosocial adaptations which shape the way victims view and respond to the world. Safety means considering whether older clients are safe. Assessment with victims of sexual violence should include: is the client in imminent danger? Are barriers present that may impede further assessment? Is the client cognitively impaired? Does the client exhibit signs of shame, guilt, anxiety, and/or fear? Are there health concerns? Does the client have financial resources for their basic needs? Has abuse or neglect increased in frequency or severity over time? Social justice is a response to social injustice and supports change to conditions causing inequalities. Social injustices can occur on grounds of economic status, education, religion, disability, racism, ageism, and sexism. There are many theories of social justice in psychology and counseling. One theory is that client struggles are reactions to problems entrenched in society. Ageism consists of adverse social attitudes which stigmatize older individuals merely because of their age. Healthcare professionals have different standards for treating older adults compared to younger and prefer to care for the latter under like conditions. Negative views towards older adults due to their age can present indirect obstacles in identifying sexual assault. Professionals unaware of their biases can unconsciously treat older adults as asexual, which obstructs their capacity to tell when older adults are being sexually abused. When older clients are considered sexually unattractive by societal standards of beauty, professionals may overlook sexual abuse as possible cause for presenting problems.